Presentation is Mitochondrial Dysfunction and Autism, understanding the negative impact it has on health and what you can do about it. Before I get into the meat of this presentation, many of you have been with me before over the past number of years with respects to these webinars. If you're new to these webinars, I just want to introduce myself. I'm Dr. Kurt Wohler. I've been a biomedical physician now since 1998, have been involved in many things with respects to biomedical intervention for autism, not only from a clinical standpoint, research, as well as education. One of the things I'm real big into is parent education as well as physician education. And a couple books I would highly recommend that you have in your library. One, the book on the left is Effective Biomedical Treatments by Dr. Pangborn and Baker. Not a book you're going to read cover to cover, but an excellent reference book. The book on the right was one of the first books I read. This is a newer edition here, at least this slide as of 2008. It's somewhat outdated, but I read the older version many years ago by Dr. Shaw, Biological Treatments for Autism and PDD. Two excellent resource books for you. Another book that Dr. Shaw came out with, I actually have a chapter in this book, Autism Beyond the Basics. This is going to go a little bit more in depth than some of just the basic talk with respects to the gluten casein-free diet or treating yeast. There's an excellent chapter in this book actually by Dr. Rosengal about hyperbaric oxygen therapy in autism. So great book here. I also have a number of resource websites on the internet. This one, autismrecoverytreatment.com, is a blog site. I record videos. Those videos are then transcribed into articles placed on this site. This is all free information. I also have a very active membership site where anybody within the U.S. and around the world can join on a monthly basis and have access to a number of things that I've created, from articles to protocols to recorded webinars. We actually just added an entire new section to this website at autismactionplan.com of videos on demand section, and this is where many of the past webinars that I've created have now been re-recorded in professional audio and synchronized with the slides in a movie format, and that's all available through this website. But we also have a very active forum where you can post questions to me on a daily basis if you choose, and there's actually a section in there for private messaging if you would prefer to do that as well. So autismactionplan.com, I encourage you to check out. I also recently released a book called Autism: The Road to Recovery. You can learn more about it at autismrecoverybook.com. It's available as an ebook, and it's also available at some of the seminars that I do in a printed format as well. Great Plains actually has a few of them, but the bulk of it is available through email. And then finally, if you want to get more information about me, presentations I've done, websites, literature, my office, etc., you can do that through drwohler.com. Okay? So let's go ahead and get started. Let me just check one thing here. All right. So we're going to talk about tonight, as far as a lecture overview, what are mitochondria, what do they do? We're going to talk about mitochondrial disease versus mitochondrial dysfunction. What is the link between mitochondrial dysfunction and autism? What are some of the problems we can see? What are some of the biomarkers that can be seen with respects to testing, causes, and then talking about some treatment options. One of them, HBOT, supplement therapy, Respen-A, we'll touch on at the end here. Just a heads up with these presentations, I don't do any question and answer towards the end because there's so much information that I present. But if you do happen to post a question, Great Plains will catalog that, and then they email that to me, usually within the week, and then I'll respond to those questions via email. So the mitochondrial disease, let's think about that, versus what we can also call disorders. These were once thought to be rare, and nowadays they're actually, because of technology and testing and awareness, etc., these are considered now to be one of the most common metabolic problems seen in kids. Now, some cases of mitochondrial diseases can occur in autism, but usually these mitochondrial diseases are brought on by genetic abnormalities or abnormalities in just the metabolic mechanism of mitochondrial function. And what we're commonly seeing here, come on, it's not switching. Okay, is we're not necessarily seeing mitochondrial disease in autism, but instead mitochondrial dysfunction. Now, with these mitochondrial diseases, some can be quite severe. Kids can have heart defects that impact the electrical and the contraction problems of the heart. We can see brain abnormalities. Kids can have seizure problems. Some can develop strokes, balance and coordination issues, etc. And as I just mentioned, the vast majority of kids on the spectrum, they have a mitochondrial dysfunction, not a true disease process within the mitochondria. So what are mitochondria? Well, if you remember back from high school biology, or maybe you took, biology or anatomy, physiology in college. Matter of fact, my son, actually, who's in 7th grade, is studying cell physiology right now, and we've been talking about mitochondrial function, glycolysis, and how all that creates, energy production in the body. Well, essentially, mitochondria are the energy factories of our cells. They're the things that create the most robust amount of cellular energy called ATP that's needed to drive the cellular function of every cell in the body. And so we know that mitochondria this is where the bulk of the energy is happening, but the mitochondria, unfortunately, are susceptible to toxicity. Now, mitochondria are also under the direction of the nucleus of the cell. They, with respect to the cell function and mechanism, and so we can have derangements in our genetics that impact the mitochondria, and that would be linked back more towards a mitochondrial disease process. But we also can have environmental toxicity, whether it's external environmental influences, or we can have derangements within our own body chemistry that can negatively impact on mitochondria as well. And then within that mitochondria, we have something called the electron transport chain, as well as something called the Krebs cycle, which is what's churning out this ATP energy currency, which is fueling all of the cells of our brain, our muscles, our immune function, and even with respect to detoxification. And one of the things that we're talking a lot about with respect to autism is helping in detoxification. Well, if we don't have good mitochondrial function and we're not producing good cellular energy, we're not going to be able to detox our body effectively, and that's one of the reasons we want to make sure we're not dealing with some type of underlying mitochondrial stress. You heard about the Krebs cycle. If you've done an organic acid test from Great Plains Laboratory before, maybe your doctor or healthcare practitioner has gone through those results with you, and you'll notice on that test there's actually a section for these different steps within the citric acid cycle. And each of these steps are intermediates in this wheel, if you will, and I think of this thing like the hub or the spokes of a tire, and each spoke is related to a different chemical reaction, and we need each of those spokes in balance for that wheel to spin correctly and be in balance. When we have a problem in one of those spokes, the wheel becomes wobbly, and the analogy would be is that our metabolism becomes wobbly, and that will impact cellular metabolism. Now, things that can impact this Krebs cycle function that we may be able to pick up on from an environmental standpoint would be the environment of the gut. Yeast and bacterial toxins are known to impact at various steps in the Krebs cycle. Certainly heavy metals can play a role, chemical toxicity can play a role, deficits in nutrients, vitamins and minerals can play a role in causing this Krebs cycle wheel to become a bit wobbly. We also know that dietary influence is huge, and not eating the right amount of food or the right type of food can create problems. If we overconsume carbohydrates, rice, potatoes, corn, these types of things, then we're not creating enough energy substrates to be burned as fuel through our mitochondria. If we're eating toxic fats, those fats create oxidative stress, which can create oxidative reactions in the cell and damage the mitochondria. If we're not getting enough protein in our diet, the same type of thing. So it's the balance of proteins, fats, and carbohydrates that is not only helping to maintain our blood sugar, but it's helping as a fuel source to fuel this cellular energy, this cellular currency that's needed in the mitochondria to keep it functioning properly. And this is just sort of an overview chart here, as we can see as things move from our diet, from proteins, carbohydrates, and fats. Carbohydrates are going to move down this glucose pathway, and then they can shunt off in different directions. But to really get at the meat of mitochondrial function, this is where we need good amount of protein and good amount of fats to be burned as a fuel source through that Krebs cycle and eventually through that electron transport chain to give us that bulk of energy currency that we need. Now it turns out that mitochondrial disorders actually have been linked to digestive problems. This was a research article out of India back in 2006 where they showed that a mitochondrial disorder was actually causing a gastrointestinal encephalopathy syndrome, which basically means that the gut function in this particular child was also causing a related problem in the brain that was tied specifically to derangements in the function of their mitochondria. And we know that in autism we often talk about the function of the gut with respect to food digestion, food toxicity, food allergies, as well as bacteria and yeast toxins having a direct impact on the brain and the nervous system. We know that there's that connection. Well, this is just further evidence that if we're also having a negative impact on the mitochondria in our cells, that can have wide sweeping effects throughout the body, not only within the digestive system, but within the nervous system as well. Okay. Let's go through, we're going to talk a little bit about a study here that was identifying issues with respect to mitochondrial disease. So this study was looking at 20 kids on the autism spectrum that did not show any evidence of mitochondrial disease patterns, and this was tested via muscle biopsy testing. But these kids did have issues with poor muscle tone, seizures, and autism spectrum issues, attention, language, and behavior. So let's define, if we can, the differences between a mitochondrial dysfunction, which is going to be abbreviated MDS, and a mitochondrial disease. We know that the mitochondrial dysfunction is more common in autism than a mitochondrial disease pattern. So we're not seeing that many kids who have this classic presentation of a mitochondrial disease, but we're seeing plenty of kids with issues with respect to a mitochondrial dysfunction, and there is some laboratory evidence that does exist to actually implicate a mitochondrial dysfunction. Okay. We also know that environmental factors, as I've mentioned before, can play a role in mitochondrial problems. I already mentioned the gut. Well, we also can have heavy metal influences, chemical influences from our environment, and these can contribute to some of the health issues that we see, whether it's cognitive problems, language issues, poor digestion problems, issues with respect to the immune system, oxidative stress, and inflammation. Now, some researchers have actually speculated that many of the problems with respect to mitochondrial dysfunction, not disease, but dysfunction in autism actually is environmentally induced. And this is just an extended list of what I've already mentioned. One of the other things which I wanted to point out, in addition to pesticides and heavy metals, etc., is that gut toxins can have a direct effect on mitochondrial function. I actually have a presentation on yeast toxicity and how different yeast biomarkers will actually interfere with those different steps in the Krebs cycle. So the bottom line here simply is that what we're doing with respect to biomedical intervention in autism is trying to reduce as many toxic stressors as possible, and in doing so we can improve our bodies, or the kids can improve their body metabolism. And this slide really is sort of it's just an extension, if you will, of what we've already been talking about. So we know that kids have language problems, we know that they have cognitive issues, we know that they have gastrointestinal problems, we know that they can have poor muscle tone. All of these things can be linked back to problems that are occurring within the mitochondria. I don't want to give an indication here that this presentation is that all of the problems that we're seeing in autism are strictly related to a mitochondrial issue. But one of the reasons that I highly recommend, at least minimally, doing the organic acid test is that we can at least, through a urine test, get a snapshot of mitochondrial function to be able to pick up on some type of issues that might be occurring. So if you've not done that test, I would highly recommend you do so. One of the reasons that the mitochondria are so vulnerable to oxidative stress is that they're a highly functional cellular unit in the cell, and the mitochondria actually contain a large amount of vitamin C. They contain glutathione, they contain vitamin E, and this is what's helping to protect the mitochondria against oxidative damage. We already know that glutathione is one of the things that's commonly depleted in kids on the autism spectrum, and this is one of the reasons that many of them have a high oxidative stress load, which is going to tend to drive inflammation. So the more you add on as far as yeast and bacteria, food toxicity, etc., the more oxidative stress we're going to have in our body, and the more potential that's going to have on mitochondrial function. All right, so let's talk about some biomarkers that can be done to help detect mitochondrial dysfunction. One of the things that you can do from a testing standpoint, in addition to what I mentioned with respect to the organic acid test, is looking at blood levels of lactic acid, blood levels of ammonia, pyruvate, something called creatinine kinase, and this is something picked up generally on a liver panel, which is the aspartate aminotransferase. If those are elevated, those can indicate an underlying mitochondrial issue. Also, low carnitine on a blood test is often associated with a mitochondrial disease. Now the issue is that many of these can also be found in autism in association with a mitochondrial dysfunction. So some of the things that are commonly found, and what I've seen over the years in testing, is a decreased free and total carnitine, which can be done through a blood test. Sometimes elevated ammonia, although that doesn't come back high all the time. Usually if the ammonia is elevated, it's not going to be as high as might be seen in a kid who has a true mitochondrial disease process, and oftentimes that elevated ammonia many times can be tied back to some type of gut bacterial problem, as well as elevated alanine and lactate, which you can do through blood testing as well. All right. So here's some things, and this slide is real important with respects to mitochondrial dysfunction. One of the things you can do is you can do a plasma amino acid test and look for the ratio between alanine and lysine. A level above 2.5 is consistent for a mitochondrial dysfunction. Okay, so normal ratio is between 1.5 to 2.5. So that's one marker that can indicate some type of issue going on in the mitochondria. Lactic acid, if that's high, that's another marker. Low carnitine, another marker. Elevated ammonia, which I just indicated. So all of those can be indicators of a mitochondrial dysfunction. And then I mentioned before doing the organic acid test from Great Plains. A couple things on that test which you'll often find high for some kids. fumarate and malate specifically as part of that Krebs cycle section on the organic acid test, if that's elevated, can certainly also be a strong indicator of a mitochondrial dysfunction. Sometimes you'll see the lactic as well as the pyruvic acid being high, but you always got to make sure to come back and check to see if the yeast levels or the bacterial levels on the organic acid test are elevated, because often what you'll find is that many of these markers on the organic acid test that indicate a mitochondrial issue are elevated, but it's often in relationship to a yeast problem, and you'll see those things correct when you start dealing with gut problems, or start dealing with the yeast issues in the gut. Now, when it comes to mitochondrial disease testing, there really is not a gold standard per se, but muscle biopsy testing can certainly be specific for certain problems. And there's a wide variety of these different types of testing procedures. Usually this is best, in my experience, best handled by a specialist in metabolic or mitochondrial diseases. There may be a few doctors out there that want to go that extra step here with some patients, but usually if I have a strong suspicion for a child, I'm going to refer them to a metabolic specialist to really look at things a little bit more in depth, because these tests can be expensive. They need to be very specific, and they're best, in my experience, handled through insurance if possible. So what about supplement support, supplement therapy? We already know that if you're showing evidence of a mitochondrial dysfunction off of some testing that you may have run, then it's always recommended to do the organic acid test to look for gut problems, because oftentimes the seat of those problems is coming from the gut yeast and bacteria, so you got to deal with that. But there can be some supplement therapy that can be implemented. There are some specific supplements that can help to improve the mitochondria in its function. Acetyl L-carnitine is a great product to help with that. We already know that low carnitine on a blood test can be an indicator of mitochondrial dysfunction. Various B vitamins, whether it's B1, B6, B2, can all support mitochondrial function. And this is where we get usefulness in many of the multivitamins, B complex vitamins, which many kids are put on. So anytime you're putting kids on a specific supplement regimen, in essence what you're doing is supporting underlying body chemistry and supporting mitochondrial function. Antioxidants to help decrease oxidative stress. Glutathione is a favorite and quite beneficial. Not necessarily glutathione capsules, they don't really get absorbed all that effectively, but things like glutathione cream or the lipoceutical, or what's called liposomal glutathione, which is the oral liquid glutathione, can be helpful. And then something called a mitochondrial cocktail, and this next slide here is just an example of a mitochondrial cocktail. There's a number of things that you could create your own cocktail for, but this in essence is a fairly popular cocktail, if you will, for mitochondrial support. Acetyl L-carnitine, CoQ10, NADH, and malic acid. Now these dosage recommendations here, as there are just recommendations, this is sort of on average of what I would use for a 40-pound child. CoQ10 usually dosed between 5 to 10 milligrams per kilogram. I usually dose 10 milligrams per kilogram per day. L-carnitine between 50 and 100 milligrams per kilogram per day. Usually for a 40-pound child that comes out to be about 1,000 micrograms. NADH between 5 to 10, malic acid about 500 milligrams. So many of these things, they're not necessarily dosed specifically based on age or weight. There is a range. But this is approximately for a 40-pound child, and usually what you'd find in maybe a 4 to 5 to 6-year-old. So this is a place to start. These supplements, by the way, are available from New Beginnings Nutritionals. Let me just check, make sure my sound is okay. It looks like we're okay. But again, if you get a well-rounded multivitamin, multimineral, many of these things are going to be in there. One of the things I've used with good success in my practice is Syndion, and there's other combination vitamin mineral antioxidants, but Syndion is a nice overall product. And then sometimes you just have to add a few things like the NADH or the malic acid. Okay, well, what about mitochondrial dysfunction with respect to hypoxia? We know that a decreased cerebral blood flow has been recognized in autism, where we get cerebral hypoperfusion. And we know that hypoxia, low brain oxygen, can impair mitochondrial function. And essentially what it's going to do is it's going to impair the ability of the cell or the mitochondria to produce ATP. Hyperbaric oxygen therapy has been a tried and true therapy that has been around for a long, long time now with respect to the treatment in autism, and has shown great success almost across the board. And that's not to say that every kid has benefited, nor every child in my practice has had great improvements from it. But it definitely helps the vast majority of kids who do it. I've seen some issues, from time to time where kids get hyper, or they might get yeasty or whatnot, but that is far and few between, honestly. And there's always some debate of whether you would do hyperbaric oxygen therapy in a child with a true mitochondrial disease. Luckily, in autism, we're not dealing with kids for the vast majority of times that have a mitochondrial disease. We're dealing with kids who have a functional imbalance in the body that's causing a mitochondrial dysfunction, and they do quite well with hyperbaric oxygen therapy. Whoops, here. Okay, and there's a wide variety of chambers. This is just a picture here of a hyperbaric chamber that would be used for an individual who might have a diving injury. Many of the clinics around have more of the hard shell chambers, and this is where you can get higher pressures and a higher oxygen concentration. This is a particular chamber here that is in some of the clinics. This is actually a chamber you'll see up in a clinic in Northern California at a hyperbaric clinic in Sacramento, where some kids go and they get benefit here. This can also be a chamber that would be used for an individual who might have burns on the skin or some type of skin infection. And then the real common and real popular inflatable chambers, which many parents will actually use in the home, either through a purchase or a leasing program. And there's a wide variety of protocols on this. Actually, within my Autism Action Plan site, there's an entire area on hyperbaric oxygen therapy and some protocol information as well about how to do an inflatable chamber program. The nice thing about the inflatable chambers is they're convenient for one thing. You don't have to leave the home. You can set up your own schedule. And many times over time, kids actually have fun going into the chambers. The downside is you don't get the same type of oxygen concentration that you would get if you go with 100% pure grade oxygen from a clinic that can infuse it into a hard shell chamber. And you can't get as high pressures as you might like. Usually with the soft shell chambers, we're using anywhere between 1.3 to 1.5 atmospheres, which is perfectly adequate for the vast majority of kids, with varying ranges of oxygen concentration. And actually you get pretty close now with some of the oxygen concentrators that can actually get the oxygen concentration up pretty high. So this isn't a specific talk about hyperbaric oxygen therapy. I actually do have a webinar that I've done in the past, a recorded webinar that I've done in the past about hyperbaric oxygen therapy, much more in depth, that actually can be found on the Autism Action Plan site. And also there's another website which I'll point out at the end of this presentation called Autism Seminars on Demand, where many of those webinars are held as well. I have a slide for that. So let's look at hyperbaric oxygen therapy a little bit more in depth with respect to the benefits that we can see. And this was actually, the information from this was actually taken by a research article from Dr. Rosengal in 2007 with respect to HBOT. They were using a specific blood marker called C-reactive protein, which is a marker of systemic inflammation, and which was found to be elevated in quite a number of kids in this study. The C-reactive protein responded when it was high to both the 1.3 as well as the 1 point atmospheric pressure of that chamber. And one of the speculations has been a long time with hyperbaric, and one of the benefits that we see in autism is that we know that the oxygen has a beneficial influence in increasing cellular metabolism, but it's also felt that the pressure effect of the chamber may help to lower some of the inflammation that we see. And we know that neurological inflammation is something more recognized in autism now. And so we may have a dual effect. We have the beneficial effect of the oxygen, and we also appear to have a lowering of inflammation based on possibly just the pressure effect of the chamber. Now, what is hyperbaric essentially doing? Well, the process of a hyperbaric chamber is you're increasing the oxygen concentration within the chamber to allow more of the body fluids to be perfused with oxygen, going above and beyond what our body's hemoglobin can carry. So we're actually getting a supersaturation effect within the plasma, the lymph fluid, the interstitial fluid, the cerebrospinal fluid, and getting that necessary oxygen to those areas of the brain that are needing it in a more concentrated fashion. As I mentioned before, when we're breathing oxygen just in the atmosphere, the limiting factor for our ability to transport oxygen through the blood is dependent upon the hemoglobin found in the red blood cells. Well, when you get in a pressure oxygen chamber, you're essentially increasing the partial pressure of oxygen, and you're supersaturating oxygen, essentially independent of hemoglobin levels. Now, I highlighted here in red something I thought was really pretty amazing, because it actually shows, how little oxygen you really need at a cellular level to drive this cellular energy mechanism. About 0.3% of inhaled oxygen through the lungs actually reaches the mitochondria at the cellular level. And so when we have any compromise or any decrease at all in that very small percentage, it will greatly influence mitochondrial function. And that could be from a lack of blood flow, that could be from excess inflammation that's occurring within the brain, around the cells, etc. So again, hyperbaric is sort of bypassing that and just getting more oxygen to that level. Oops, here, let me go back. So again, when we're talking about hyperbaric oxygen therapy, I want you to recognize that it is one of the more significant therapies out there to help with mitochondrial dysfunction in autism, and that's apart from the whole discussion about mitochondrial disease. Okay, so again, mitochondrial dysfunction is a little bit separate than mitochondrial disease, as is found in autism. Let me shift gears here, and let's talk about another discussion with respect to mitochondria, but specifically talking about chemicals related to something called MAOA, monoamine oxidase A. Why I put these slides in this presentation is there's a therapy I'll touch on here called Respen-A, and Respen-A has been a real positive treatment that I've seen in my practice over the past number of years with respects to kids on the spectrum, from a standpoint of social improvement, social engagement, language complexity, decrease in sensory seeking behavior, and in some kids just an overall improvement in their energy. And when I first started using Respen-A, it didn't really dawn on me at that time that we might actually be improving mitochondrial dysfunction, or maybe in flipping that around, that mitochondrial dysfunction may actually be impacting this system called monoamine oxidase A, which can then affect serotonin, etc., which is what we'll get into here. So an enzyme called MAOA, monoamine oxidase A, is an enzyme that's needed to make various protein products to help improve nerve impulse transmission in the brain, specifically histamine, serotonin, and norepinephrine. And essentially what's happening is that monoamine oxidase A is having a converting effect on these neurochemicals to produce what's called their aldehyde form, or their active aldehyde state. And that when monoamine oxidase activity is decreased, we're not getting good turnover of serotonin, histamine, and norepinephrine into their active forms, and we start to run a deficit in those systems. Serotonin is specifically linked with respect to autism from the standpoint of language, social engagement, fine gross motor skills, repetitive behavior, and you can see how that might even be impacted in certain individuals with anxiety and depression, because serotonin plays a big role in mood elevation. Norepinephrine is tied to attention, and in extreme situations actually has been linked, or imbalances in norepinephrine has been linked to schizophrenia. Histamine imbalances can lead to problems such as increased allergy and eczema, increased blood-brain barrier perfusion and neurological inflammation, and in extreme situations, not something we're seeing in autism, but in extreme situations has been linked to some of the biochemistry behind multiple sclerosis. Okay, so this is just a breakdown essentially of what these different neurochemicals do. If we focus on the left and think about histamine, histamine is going to have a positive influence on digestion. So when we have a histamine imbalance, we're going to have poor digestion, poor release of digestive enzymes. We're going to impact thyroid function. We're going to impact the immune system. We're going to impact the pineal gland, so sleep can become an issue. We're going to impact myelin and the blood-brain barrier. A lot of this is tied, as I said, to extreme situations such as multiple sclerosis, but some of these things can be seen in autism as well. I see a lot of kids who have sleep problems, a lot of kids who have digestive problems, seeing more kids with thyroid dysfunction, etc. If we come over to the right and we look specifically at norepinephrine, we know that norepinephrine is geared towards focusing and concentration, something we see quite often with kids on the spectrum, sensory issues, memory and social recognition problems, etc. So we can see where that lines up. And again, in extreme situations, we would be concerned about, or might be linked in some respects, to schizophrenia. But serotonin is the one that is very commonly associated with respect to autism, because again, it has the effect on mood, fine gross motor skills, sensory integration, and so forth. Okay. And this slide here is just a little bit more of the same. So decreased monoamine oxidase activity with respect to autism is going to be specifically tied to the serotonin system. It also talks about oxytocin. I'm not going to get in depth here. That goes off into a whole other area of discussion. I actually have an entire presentation about oxytocin and the link that it has to serotonin. But let's just focus right now on just the overall function of monoamine oxidase A, and why I included it in this talk is because monoamine oxidase A is actually a mitochondrial enzyme. So we can see that if we have things that are impacting upon mitochondria, whether it's yeast, bacterial toxins, heavy metal issues, chemical toxins, if there's something going on genetically, that influences the mitochondria, we're going to potentially have a negative impact on the production of monoamine oxidase A, which is then going to have a problem with respect to serotonin metabolism. Okay, I'm going to pass through this slide here. This slide is just sort of reiterating what we already know and what we already talked about with respects to the mitochondria. Okay. I'm going to go through this as well. By the way, let me back up here real quickly. And this is a little bit off topic. This is just a sort of a picture representation of the food that we eat, and we can see here that we add in proteins, fats, and carbohydrates, and we start to create some ATP. We start to create this byproduct of acetyl coenzyme A that gets spun through the Krebs cycle, and then eventually through the electron transport chain. And at the end result, we're producing a huge amount of this chemical substrate called ATP. Well, it turns out that if you've got mitochondrial problems, again, you're going to be really messing with your ability to make a lot of ATP. And the problem with that is that what ends up happening is we become dependent on energy production primarily through glycolysis. Glycolysis is that stage one of energy metabolism that is primarily tied to carbohydrate processing or glucose processing within the cell. And when we have the inability to really access energy production through the mitochondria, we end up making a lot of lactic acid. So one of the tests that you can do through a blood test is look at lactic acid levels in the blood, as well as look at lactic acid levels through an organic acid test and see if it's high. Lactic acid is that acid that we all feel if you haven't exercised in a while. You go to the gym, you lift weights, you go for a run, and the next day you wake up and your muscles are sore. Well, lactic acid is what's causing some of that. But this thing can become chronically elevated, and over time actually lead to metabolic acidosis, which creates a pH problem in the body. It turns out that oxalates, which is something that's talked about quite a bit, something that you can actually test through the organic acid test. Oxalates will disrupt the metabolic conversion of pyruvic acid into acetyl coenzyme A, and as a byproduct of that, you can sometimes see an increase in lactic acid production. So what happens is that excess oxalic acid or excess oxalates through the diet can disrupt body metabolism, blocking or partially blocking the ability of getting energy substrate into the cell to be used through the mitochondria. It's not necessarily, well, it may, have a direct impact on mitochondrial function, but essentially, for the most part, it's blocking the ability to transport acetyl coenzyme A into the cell, and therefore you start to have a backup in energy metabolism, and you have a buildup of lactic acid. So another side note to what we look at biomedically here, and this is one reason, and it's difficult, and I've asked parents over the years if they can get a sense if their kids appear like they're in pain. Some parents can describe that their kids look like they may be having headaches, or that they just don't feel good physically. Clearly we know adults with fibromyalgia and chronic fatigue often will complain of muscle pain, connective tissue pain, just pain in the body, and that when you test an organic acid test, a lot of times they'll have things elevated like lactic acid, or their oxalic acid levels are elevated. So there's a reason, or a physical reason, to why they're feeling the way they do. Okay. So essentially with this discussion, that when we start to disrupt the electron transport chain within the cell, we can start to have a problem where the cells become dehydrated. When the cells become dehydrated, we can also start to have a buildup of acidosis within the cells. With the acidosis, we get inflammation, which can then lead to a lot of just chronic health problems overall and some of the neurological issues. One of the things that you'll see too on an organic acid test, many times when you see the lactic acid marker being high, or you'll see the oxalic acid level being high, is the phosphoric acid marker on the organic acid test can be high as well. What happens is that phosphoric acid is tied to calcium phosphate, which is in the bones. And so when there's a lot of metabolic acids flowing through the system, this calcium phosphate is released, okay, because the phosphate is a neutralizing agent for acid, and then you just get an increased level of free calcium that is now circulating throughout the body. So essentially what happens is you see that phosphoric acid level elevated because in essence what the body's trying to do is buffer some of these acids. And again, you'll often see that on the organic acid test when the oxalic acid level is high, sometimes when the lactic acid level is high, or sometimes the bacteria and yeast levels are high. Well, it turns out that high blood calcium can be a trigger for inflammation itself. And one of the things that we know that happen in the brain with excess glutamate sensitivity in the brain is that when glutamate triggers with those NMDA receptors, it causes an influx of calcium into the cell and can trigger neurological inflammation. Well, it turns out that high blood calcium levels alone can trigger inflammation throughout mast cells throughout the body as well. So one of the reasons we actually may see an increase in just systemic inflammation is because of too much blood calcium in circulation because of metabolic acids that can be directly linked back to problems in the mitochondria, to oxalic acids, to yeast and bacteria, etc. This is a little bit, off topic just from an autism standpoint, but if we think about it with respect to aging and then other neurodegenerative disorders that are becoming more and more prevalent in our society, there is something called ubiquitin. And what happens is various proteins that get produced in our cells essentially break down and need to be recycled. And when we don't have enough cellular energy, we don't have enough ATP because our mitochondria are now dysfunctional, are now weak, are not producing enough of this cellular energy, we can't get rid of some of this old debris that's sitting inside our cells. And that alone can be a trigger for inflammation, and that alone can cause stress within the cells, but it can also start to engage the immune system. What happens is when we don't have enough energy currency to get rid of these recycled or these broken down proteins, somehow the body tries to get rid of them. And we start to activate various immune cells to take over that job. Specifically things called from the Th1 immune system and specifically CD8 cells. It turns out that CD8 cells are immune suppressors. What they do from CD4 and CD8 is that when we have an overabundance of CD8 production, it'll end up putting a strain on our immune system and weakening our immune system, essentially turning it off. So we know that CD4 cells are part of the helper T immune system that helps to regulate the immune function, but these CD8 cells essentially are like a brake, or they slow that process down. Actually what the CD8 cells do is they'll put a a stopgap, or they'll slow down the function of CD4. So if we can't clear out these toxic byproducts in our cells that's generating a lot of this toxic stress, our immune system becomes involved, and over time it weakens our immune system. So this whole discussion can get quite involved, but if we tie it all back to some of the things that we see going on in autism, we clearly can see that at that mitochondrial level is where the real meat and potatoes is of what's happening at a cellular level, and why it's so important to be doing supplement therapy, to be working on dietary therapy, to be reducing yeast and bacterial toxins, to trying to reduce as many environmental stressors as we can so that the cells just have a chance to work better. So why did I go through all this madness, with these slides? I wanted to point out for some of you who either have heard about Respen-A but weren't sure what it was, or think about Respen-A as a link to this whole discussion with respect to mitochondria. Coming up with a supplement program like a mitochondrial cocktail is fairly straightforward. I mean, most of us, from many of the supplement companies that support the kids on the spectrum, like New Beginnings and others, are going to carry CoQ10, are going to carry carnitine. Many of them will carry NADH or malic acid. You can implement glutathione or B vitamins or vitamin C and vitamin E just by doing a multivitamin, multimineral. All of that's going to support mitochondrial function. But then taking it, a little bit deeper is understanding that gut toxins, yeast and bacteria, are critically important, and so those things need to be addressed too. We certainly know through our discussions over the years with respect to heavy metal toxicity, chemical toxicity, that that's important too. You may not have thought about hyperbaric oxygen therapy being something that can help in mitochondrial dysfunction, but clearly we can see just by improving the oxygen concentration in the body and delivering more oxygen, even a little bit, to the mitochondria is going to help it function better. But by decreasing inflammation, that also is going to help mitochondria function better as well. And then we flip our discussion over here into Respen-A. Well, it turns out that Respen-A is a patch that contains an ingredient called reserpine. Reserpine comes from an old Indian herb called Rauwolfia, and studies long ago in the 50s and 60s actually showed, there was one study specifically that showed high dose reserpine being used as an oral elixir was quite beneficial in a group of autistic kids, improved with respect to their sociability, their language, their attention and focusing, and their behavior. Reserpine has primarily been used as an herbal remedy for high blood pressure. It's not really used for that anymore because as medical research has advanced, there are some great antihypertensive drugs out there, so nobody uses reserpine. Well, reserpine, what it primarily does is it activates this monoamine oxidase A enzyme. And it helps to improve MAOA function, and what we're seeing is that it's having a positive influence at improving serotonin metabolism. Again, serotonin, if we just focus on that, has been greatly associated with many of the core issues that we see in autism, from the sensory problems, the self-stimulatory issues, in some kids with respect to language deficits, sociability issues, etc. What are some of the benefits that I've seen in my practice with respect to Respen-A? Well, probably number one would have to do with improvement in sociability, where the child becomes more engaged with the family, they're more willing to participate. Sometimes that's with family members, it could be brother or sister, or maybe some kids in the neighborhood. The second thing that I've seen improve with respect to Respen-A therapy is language. I haven't had a child who was nonverbal start to speak, but I've had kids who had even limited language start to speak more, and kids who at least had some ability to put a few words together start to have more complex speech. Many parents early on explained to me that their child's speech became more deliberate, more specific, more elaborate. I've also seen kids improve with respects to their mood, which again is going to tie back to serotonin and the influence that serotonin has in the brain. Kids many times seem happier. Again, serotonin helps with happy. One of the reasons so many people are put on selective serotonin reuptake inhibitors in this country is because so many people are depressed and stressed out. One interesting thing I've seen with Respen-A is an improvement in self-initiation. An example I give as it's expressed to me from a parent was her boy would go to school, and it was a kindergarten class, and every day, the kids were told, go get a piece of paper and go get a couple crayons, go to your table, sit down, and start drawing. Well, this kid would come in, and every day he'd go to his table, and he'd have to be prompted to go over, get some crayons, get a piece of paper, go back to his table, and start drawing. Well, about a week or so into the Respen-A therapy, he came into the room and then started going and getting the crayons and the paper himself and sitting down and drawing without having to be prompted to do so. And I've seen other parents describe the fact that their kids just seem to be more self-motivated or self-initiating things that they were always before having to be told what to do. If you want to get more information about Respen-A, you actually can go to respen-a.com and just read through their frequently asked questions section. I've done some past webinars on this. I also have a number of videos on the Respen-A website that you can access that go much more in depth into Respen-A. Will Respen-A help specifically with mitochondrial function? Well, in essence, it's helping overall with neurochemistry, in the brain. But the reason I put it in here is that, in essence, that monoamine oxidase A enzyme, which we know positively influences serotonin, histamine, and norepinephrine, is tied to the mitochondria. So if we have other things that are impacting the mitochondria, that's when we're going to start to have an impact on serotonin. So I can't say specifically that Respen-A is going to strengthen mitochondrial function, but what it will do and what it can do is it can strengthen neurochemistry function in the body, and as you start to work biomedically in other areas, gut, yeast, bacteria, diet, supplements, over time you see an improvement overall in a child's overall function and ability. One of the other things that you will see too, if we step back and think about some of these therapies, like hyperbaric oxygen therapy, like supplement therapy, is an improvement overall in a child's vitality, and that can manifest as an improvement in their energy stamina, that can improve in their vitality of their immune system, the vitality of their brain with respect to learning and memory and focusing and attention, and just a decrease in that stress that many of the kids have, whether it's related to anxiety or ritualistic behavior or sleeping problems, etc. So I can't say that there is one specific therapy for mitochondrial dysfunction, but we definitely know that mitochondrial dysfunction is quite prevalent in autism, and it's tied back to everything that we've been talking about, these past number of years, that's linked to diet and gut problems, etc. So with that, if anybody wants to contact me, you can do so in a number of ways. I do provide consultations for people throughout the U.S. and around the world. I do Skype, internet consulting. I have office and phone consulting as well. You can get information through drwohler.com if you want to access me more directly. And again, it's not listed here, but if you want to ask questions of me, even on a daily basis, and I answer questions in the day, in the evenings, weekends, holidays, autismactionplan.com is the best place to do it. through that parent forum, and you can post me privately through there as well. Two things. We originally created autism seminars on demand to host many of the recorded webinars that I've given through Great Plains over the past number of years, and you can access each individual webinar recorded as a movie file, as well as have access to the downloadable color slides of each of these presentations through autismseminarsondemand.com. But we also have loaded that information through on the autismactionplan.com website as well. So there's a couple different places that you can access the information. All right. So with that, I appreciate everybody's attention. I hope for most of you it came through okay. I know it's frustrating with the mic. I don't know what was going on tonight. Hopefully you were able to get the vast majority of it. If you did happen to post a question, as I mentioned before, Great Plains will grab that question. That question will then be sent to me through email, usually within a week, and then I'll respond, directly back to them based on your question, and you'll get that information. Okay. All right, everybody. I know that was a mouthful tonight. Thanks for hanging with me, and we will see you next month. Take care.